Now let's learn about the administration section. In this video, we are going to talk about practicing ICD-10-PCS coding for the administration section. Like all of our ICD-10-PCS codes, the administration section codes also have a 7-character code format. The code characters are: the first character is for this section, second character is for the body system, third character is for the root operation, fourth character is for the body system, fifth character is for the approach, sixth character is for the substance, and seventh character is for the qualifier. Now let's look at the root operations that you will see in the administration section. We only have 3. They are introduction, irrigation, and transfusion. Again, if you open up your ICD-10-PCS code book, in the back there is the root operation definition appendix. Again, it's very helpful to make flashcards to help master these terms, but let's look at these definitions. The definition for introduction is putting in or on a therapeutic, diagnostic, nutritional, physiological, or prophylactic substance except blood or blood products. The definition of irrigation is putting in or on a cleansing substance. And the definition of transfusion is putting in blood or blood products. Now let's go ahead and do some practice. We have 2 cases that I want to practice with. Our first case is a 57-year-old who comes in for a percutaneous irrigation of the knee joint. So we always ask ourselves first and foremost, what is our root operation and what is our ICD-10-PCS code? So you determine your root operation from the scenario you're coding, and that is the key word that you look up in your ICD-10-PCS index. So hopefully you guys identified irrigation as the root operation. So again, you're going to open up your ICD-10-PCS codebook. At the very front where the alphabetical index is, we're going to look up irrigation. From there, you're going to go to joint, and then irrigating substance, and we're giving all 7 characters of our code right there in the index. So you will see code 3E1U3A Z in the ICD-10-PCS index under irrigation, joint, irrigating substance. Now let's look at another case. So for our practice case 2, we have a 49-year-old patient who's having an esophagogastroscopy with a Botox injection into the esophageal sphincter. So again, you always ask yourself, what is our root operation? And from there, we're going to determine what is our ICD-10-PCS code. So we only had 3 root operations that we could pick from in this administration section. And the one we would pick for the Botox is introduction. So if you open up your PCS codebook, in the index you're going to go to introduction of substance, in or on, and it was in the gastrointestinal tract. And because it was esophagogastroscopy, then we know it's upper, so we're going to pick upper. Then we see 3E0G by the term upper. We're going to go to table 3E0G, and we have to pick our 5th, 6th, and 7th character from there. So once you're at table 3E0, you're going to pick row G for the 4th character, which we already knew from the index. Then for our 5th character, we're going to pick 8 because our procedure was done via a scope. So we're going to pick 8 for via natural or artificial opening endoscopic. Then our 6th character, we're going to pick G for other therapeutic substance. Botox paralyzes, so that's why we're going to pick other. And then also for our 7th character, we're going to pick other substance or character C. So the correct code is 3E0G8GC.